So someone asked a question around the economic losses of COVID-19. So we've described before that a pandemic has three legs. We call it the pandemic tripod. There is the one leg is the public health crisis. The second leg is the economic crisis. And the third leg is the security crisis. Now the job of government is to find the balance so that that community is standing on three legs. So we have to manage the public health crisis in conjunction with the economic and the security crisis. The government must find a way of dealing with the public health crisis without causing an economic or a security crisis. Otherwise, we may indeed get more fatalities from loss of or breakdown of law and order, or from malnutrition, or from people dying from other conditions other than COVID-19. So it's a very delicate balance to strike, and government is doing its best. That's why you see that the government is making certain changes and policy decisions to ensure that we find that balance between the tripod of pandemic outbreak. Finding a balance with the medical side, with the economic side, and the security side, so that Lagos and Lagosians are not distressed by loss of livelihood and breakdown of law and order in our attempt to manage a medical crisis. So the message of hope to Lagosians is that, contrary to what we're seeing in other countries, that most of our patients, at least 70 to 80% of our patients, catch COVID-19 and will recover naturally. As long as you're resting and you're taking a balanced diet and you keep yourself at home, you will recover. A fewer number will have a moderate disease. In other words, they will feel unwell for a week or so, but they also will recover. Then there's a much smaller number of people, say about 5 to 10%, who will struggle with COVID-19. And it is those people that we really want to know. Members of community should alert us through our numbers, our 08,000 corona. We should be custodians of each other. If you know somebody that has been unwell for a number of days and is not getting better, call us. If they have COVID, we want to know about it. If they show signs that they are very weak, they have got high fever, or they are developing a cough, and they're showing signs of difficulty of breathing, we want to see these patients, because if we start treatment in our isolation centers, there's a chance that we can rescue you from getting into a critical state. So we want to know about the patients who have moderate to severe disease, and we want to bring those to our isolation centers and manage them with our treatments to make sure that we stop them from going into respiratory failure, which is what is the #1 killer in COVID-19. And if we know about you early, we can prevent you from going into respiratory failure with the treatment strategies that we have. Many people are presenting to us late, and that is responsible for the number of deaths that we've seen in our isolation centers. If you come to us too late, many people die on the way to the hospital, or die while we're trying to admit them, or die soon after admission, because you've gone past the point where medical intervention can save your life. So we don't want you to come to us at that late stage. We would rather know about you when you're feeling very weak, when you've got a high fever, and you're having difficulty eating, and you're beginning to have respiratory symptoms, even before you become breathless. We would like to see you so that we can manage you and treat your infection. So there were some questions around the primary health care, so I'll leave the permanent secretary of the Primary Healthcare Board, to talk around the issues around the observations at the primary healthcare, and also maybe a little bit about how the doctors are coping at the primary healthcare level. And in response to my colleague from IAT, there is no reason. I'm not aware of any reason for you not to be invited or for me to appear. So at the next opportunity, I will certainly do so.